I turn it over to you.
Thank you, Dana. Good afternoon, everyone. Before I get into the updates on our COVID numbers and COVID statistics, I would like to offer some remarks about the important letter that was circulated this morning and signed by a coalition of chief medical officers and chief nursing officers of more than 20 Michigan health systems, urging our unvaccinated people to get their shots. Barbara will do the same in her remarks. We are truly at a critical crossroad at this point with this pandemic, and our message could not be more clear. If we don't get more people vaccinated, our collective health system will be strained again. As our children are returning to schools and colleges, and as the flu season is looming, the situation can get dire very, very fast. Our hospitals might not have the capacity to care for everyone who needs care in a hospital. If COVID is able to overrun our hospitals again, like it has done a year plus ago, and if it fills our intensive care units, caring for other patients with life-threatening conditions like heart attack, advanced cancer, stroke, injuries from bad car accidents could be significantly impacted in weeks and months ahead. People will not be able to get the care that they need. Currently, in the United States alone, more than 370 million doses of vaccines have been administered, and more than 205 million people have received at least one dose of the vaccine. At Henry Ford, we are happy to see that the number of our employees who have been vaccinated have been climbing up steadily. We are currently at least 92% of our working force who have received at least one dose of their vaccine. The data is very, very clear. The science is clear. Vaccines are safe and effective. Getting vaccinated is the right thing to do for your health, the health of your family, the health of your friend and your community if you're not being vaccinated yet. We know that seat belts and speed limits can save our lives if we are in a car accidents. We know that smoking-free regulations are essential to decrease the health risk of tobacco for the communities that we live in. We also know that COVID vaccine can save all of us from serious illnesses and from dying from COVID. As far as our COVID data at Henry Ford Health System, as of this morning, we have 90 hospitalizations across our 5 hospitals, and we have a number of patients that are still at the present time waiting for some of their test results. The highest number of our COVID patients is at Henry Ford Hospital in Detroit with 31 patients in our downtown campus. We have 17 patients at Henry Ford Macomb Hospital. We have 17 at Henry Ford Allegiance, 13 at Henry Ford West Bloomfield, and 11 at Henry Ford Wyandotte. We also have 1 patient in our behavioral health psychiatric hospital at Kingswood who tested positive for COVID. Of people who are hospitalized at the present time, 84% are unvaccinated. Of the patients who are in our intensive care units, 90% are unvaccinated. Our test positivity rate as of this morning is 10%, and it has been hovering in that range over the past few days, going down half a point or going up half a point one day after the other. These numbers continue to be worrisome to us. And these numbers align what we are seeing statewide. Statewide in Michigan, infections are up 42% and hospitalizations are up 40% in the past 2 weeks. This is a good time to remind everyone of the effectiveness of monoclonal antibody therapy and their benefits in people who have been exposed and are showing signs of it and are infected. This is a one-time treatment that can keep the disease from getting more serious, decrease the symptoms that patients are having, and prevent their need for hospitalization or from them getting very sick and needing to be in the intensive care unit. We are currently providing this therapy at multiple of our locations, including Clinton Township, Dearborn, Detroit, Jackson, and Novi. Since the day we started giving vaccinations on December 17th, 2020, we've said all along that vaccination is the only way out of this pandemic. It has proven safe, it has proven effective, and the science continues to build the data about the fact that it is the way to get us out of this crisis that we are living in. Time is of an essence. We see what is happening in many of the states around this nation. Many of the southern states have such high numbers that their ICU beds are filled by COVID patients. Their pediatric hospitals are filled with pediatric patients with COVID. For those who are still hesitant or reluctant, know that you are at high risk of getting infected, especially at the present time with the high transmittable Delta variant. Not only you are at risk of being infected yourself, you are at risk of passing that infection to people around you, to your loved ones, to your family, to your friends. For moms who are expecting, we have more and more evidence at the present time that not only the vaccines are safe in pregnancy, but COVID infection in pregnancy has significant deleterious effect for the mom and the baby. So this is where we urge you to seriously consider being vaccinated even when you are pregnant. And our professional society, the American College of Obstetrics and Gynecology, as well as other professional societies, support that recommendation. We need every one of you in this fight to end this pandemic. Please get your shot and mask up if you've not gotten your shot yet. You'll protect yourself, you'll protect others, and you'll help everyone getting out of this pandemic and this global crisis that we've been living through. I would like to turn it over now to my colleague, our Chief Nursing Officer, Barbara Rossmann. Barbara?
Barbara, I did have to mute you because you were popping onto the screen while Dr. Munkarah was talking, so please make sure you unmute yourself. Trying to do it for you, but it's not working out. Okay, so you're going to need to unmute yourself on your phone rather than on the computer. Yeah, sorry about that. Barbara, we still can't hear you. Looking for your number again so I can unmute you if possible. We can't, oh, there you are. We still can't hear you, so hold for just a second. Let's see if I can manually unmute you. So I'm requesting you unmute. Are you seeing anything on your phone there? No? You are? We still can't hear you. We cannot hear Barbara. Okay, so Barbara, this is what I'm going to have you do. I'm going to have you go ahead and hang up, dial back in. In the meantime, since I do see two hands up already, we'll go ahead and Kristen Seamus, since you are here, go ahead and unmute yourself and ask your question, and hopefully Dr. Munkarah can take care of that.
Thanks so much for taking it today. I appreciate it. I'm curious, are you seeing increasing pressure on the Henry Ford emergency rooms because of COVID right now? And what is the average wait time for care in the ERs?
Kristen, I would say, yes, we are seeing increased pressure in our emergency rooms, not only because of COVID, but also because of non-COVID related patients. So we are seeing very, very heavy traffic through our emergency departments. In addition to the fact that, as you have heard from many other healthcare systems, we are first facing a workforce shortage, including in nursing as well as in nurse assistants, in other medical technical staff, and the fact that our hospitals at full capacity, which is, essentially delays people getting admitted to the hospital. So we've been seeing some really delays in our emergency departments.
And
I do not know what's the exact weight. It varies by our hospital, and this is something that varies depending on the time of the day.
And to follow up on that a little bit, given that you're seeing a bit of a crush on the emergency room, you're seeing COVID admissions, and you're seeing also the staff issue, I wondered if you could talk also about where things stand with vaccinating your staff and whether you're about to see an exodus here in a few days, September 10th, of those who have not been vaccinated on top of this crunch from COVID.
So we are currently over 92% of our staff who have got at least one dose of the vaccine. And we continue to work with the rest of the group over the next few days, 9 to 10 days, to make sure that we address their concerns, whether they have legitimate exemptions that we will be able to process, or whether there are other questions that they have related to the vaccine that we can get it. So we hope that we'll be able to retain all our staff and will not have to see any of these of our team members depart. With that said, we also have been able to kind of come up with mitigation plans going forward in case we have the unfortunate situation of losing some of our staff, to determine where our situation, where we can cross cover, what are the services that we need to kind of keep an eye on, and what is our essentially redeployment planning.
Thank you, Dr. Munkarah, and thank you, Kristen and Tim. I see your hand up, but we're going to resume our regularly scheduled program. Barbara, can I check your microphone again, please?
Yes, can you hear me?
We can hear you now. Okay, so we're going to turn it back over to Barbara to go ahead and bring you her part of the briefing.
I sincerely apologize for whatever that was. So thank you
No
all
worries.
for your patience.
No worries.
Thank you. Thank you, Dr. Munkarah. Good afternoon, everyone. As Dr. Munkarah indicated earlier, this morning something happened that we don't see very often. The chief medical officers and the chief nursing officers of more than 20 different health systems across Michigan banded together to write a letter urging the unvaccinated public to please do the right thing, the safest thing, and get vaccinated. On behalf of Henry Ford Health System, Dr. Munkarah and I signed this letter because we are all in this together and we have the opportunity to end this pandemic together. As the Chief Nursing Officer of Henry Ford Health System, I feel very proud to have my name included with the letter. We hope that those who still are on the fence about taking the vaccine will take heart, knowing that medical leaders throughout our great state truly and firmly believe that these vaccines are safe and effective. Nationally, approximately 99% of people who are dying from COVID these days are unvaccinated. And this is so unfortunate and tragic because we have a free vaccine that is safe and is saving lives, as Dr. Munkarah pointed out earlier. We are profoundly grateful to our frontline workers, including our nurses, who have given their all and then some for the past 18 months, but it has taken its toll. As you know, nurses bring special skills to hospitalized patients. When we consider the needs of COVID patients specifically, our nurses must dedicate more hours per patient day to their complex care of these COVID patients than might be required for other hospitalized patients. There simply are not enough hours available within our staffing resources, so our nurses are consistently asked to work additional shifts to keep our patients safe. They have few chances to catch their breath after 18 months of this pandemic, and the emotional and physical toll is certainly not sustainable. When you consider the traumatic events that mark this pandemic, I think you get a sense of what our nurses have been facing. They were our early innovators. They helped develop extraordinary solutions to seemingly impossible challenges. As we improved our collective knowledge of the best treatment approaches, nurses pivoted time and time again. When the vaccine became available, each one of us had a new sense of hope. Now the sacrifices that they're making are met with a looming fourth surge. So clearly unnecessary, given the solution is right in front of us and readily available. Emotionally, they are also supporting patients who are much younger than the first 3 surges, as Dr. Munkarah discussed earlier, bringing a totally different level of family distress and trauma to the bedside. Along with that, nationally, we are experiencing the worst shortage of registered nurses in history. Some of this shortage we did anticipate due to our aging workforce and in regions with a higher percentage of aging residents who need more hospitalized care. The pandemic, however, is making the nursing shortage much more profound. So we are calling on those who are on the fence about vaccination to please trust their healthcare professionals. Trust their physicians when he or she recommends a vaccination. Trust your nurse who was at the bedside for your loved one when they were in the hospital. You trusted us when making other medical decisions in your life. Please, you can trust us now. And now I will turn that over. Thank you.
Thank you, Barbara, very much. Folks, we'll go ahead and open it back up to questions. Dr. Munkarah does have to leave us at 10 after, so if you have questions, please be sure to let me know ASAP. Next on my list, because Tim is not here, is Jacob. Jacob, can you please let us know which outlet you're with and then go ahead and ask your question.
Hi there, this is Jacob Kanzler with MERS News in Lansing. Appreciate you taking the question. This is for either of the doctors or the Henry Ford officials on the call here. I wanted to ask if you were aware that a doctor who said that he's affiliated with Henry Ford by the name of Dr. Mohanid Talia testified before a House committee in August and made a number of claims, including that SARS-CoV-2 is not a natural coronavirus, but rather a man-made virus that has been in the works for over 2 decades. And said something about Dr. Fauci contributing to some of the research to this and a number of other claims. And I wanted to see if, one, if you were aware of this, and two, your reaction to one of your own staff members testifying before a House committee on some of these matters.
Thank you, Jacob. So first, to make it clear, the doctor that you have mentioned is an independent physician who has staff privileges at Henry Ford West Bloomfield Hospital. So he's independent, not employed by our hospital. Now, with that said, this has come to our attention. As soon as this come to our attention, we met with the physician to understand, what was his intention behind that testimony. Obviously, everybody has the freedom of expressing their own opinion. We wanted to make sure that Dr. Talia is not perceived as representing the opinion of Henry Ford Health System or any of our physicians. So Dr. Talia was speaking on his own behalf. He affirmed and confirmed when we met with him that he was speaking on that behalf. And he just mentioned that he was working at West Bloomfield or have privileges at West Bloomfield Hospital. So we don't agree with his statements that are his own personal statements. Our whole medical leadership is behind the statements that we are making, the support of the vaccine, our understanding that this is a global crisis that we are dealing with, and it is not a hoax. We live it. As Barbara has said, our physicians and nurses, day in and day out, are taking care of patients who are sick, who are dying. We grieve them. We've lost our own staff to this COVID crisis. So we are offended by a statement that kind of claims that this is not the truth. And as I said, Dr. Talia is representing his own views.
Thank you very much, Dr. Munkarah. Next on my list is Peter Maxwell. Peter, go ahead and open your mic and let us know what outlet you're with, please.
Hi, all. I'm Peter Maxwell, 7 Action News here in Detroit. My question is, across the country, we're seeing hospitals start to delay certain elective surgeries. Does Henry Ford plan on postponing certain elective surgeries as cases do start to increase here in the Metro Detroit area, and with the possible looming fourth surge coming this fall?
Peter, so far we have avoided any major rescheduling of surgeries. However, we are concerned, as we mentioned before, that if the numbers continue to climb where they are with the workforce shortage, and if our hospitals start to filling up more with COVID, therefore we need to redeploy resources to the COVID patient from non-COVID patients that will have to do that. Fortunately, we've not had to do any major rescheduling at the present time. There might have been a case or two that have had to be postponed a day or two, but we've not had to go through any major holding off or stopping any specific clinical services at the present time.
Thank you.
Thank you, Dr. Munkarah. Thank you, Peter. Tim, if you're in the room, go ahead and open your microphone and ask your question. Also, please let us know which outlet you're with.
Thanks, Dana. I work for anybody that will pay me. Doctor.
But who are you working for on this occasion, please?
Channel 2, Channel 6, and my wife.
Thank you very much.
Doctor, have you seen the data that suggests that Delta variant is petering out after 2 to 2.5 months, which we've seen in other nations and also in other parts? Have you seen that data? And is Michigan anticipating that Delta will get worse before it gets better, or are we turning the corner on Delta?
So Tim, I am aware of some of the data that you have mentioned. Currently, what we have seen is that the R0 what's called the infection rate or transmission rate that we had seem to have starting to level off, to start coming down in the communities that we are serving. And we are hoping that this is a reflection that we are starting to get into some stability of the cases. The problem is that this is, and I'm speaking now to the areas that the tri-county areas, as well as the area that our Henry Ford Allegiance Hospital is serving at. But we know that the numbers across the states have continued to climb, and we continue to have very high infection rate across many of the regions. I can tell you one of our biggest concern with the return to school at the present time, if we don't have enough people vaccinated and people are not following the mitigation and protection guidelines that are out there for masking and social distancing, we might see another surge that takes us in the wrong direction. So far, keeping our fingers crossed, things have been stable, but we are concerned with what might come in the next few weeks.
Would it help if the state ordered mandatory masks in all schools, Doctor?
I am not going to kind of determine what the state will order or not, Tim, because we are seeing a lot of back and forth on this. But what we know the science tells us at the present time is that masking is protective, does help. And at a time where we have a Delta variant that's ramping around, we believe that masking indoors is very important.
Thank you, Doctor.
Thank you, Dr. Munkarah. And folks, we do have to let Dr. Munkarah go in 10 minutes. So if you have another question, go ahead and send me a message in the chat. In the meantime, I'm going to address this question to Barbara. And Barbara, let me go ahead and pin you before that's not as painful as it sounds. I'm just pinning your video. I want to ask you this. So Dr. Munkarah mentioned that there is a collective strain on the health system. What I want to reiterate, and what I think that the letter you signed today reiterates, is that when we're talking about a collective health system, we are talking about the health system of all of the hospitals in our state and in states surrounding us. So can you talk to us a little bit more about the effect of this surge on health hospitals all over, and how we're not just talking about here in the Detroit and Metro Detroit area?
No, we're not. Dana, thank you very much for that question. We are talking about all of the health systems and hospitals that collectively signed the letter, and it affects all of us. As we all know, we have a workforce shortage generally across Michigan, and it is exacerbated in a number of areas, of which nursing is one of them. And to the degree that we have patients that are coming into the hospitals that can otherwise not have to be in the hospital because of having received the COVID vaccine, it puts an added burden on all of the care providers that are providing care within our health system. So nurses, physicians, the support services that support all of those that provide direct care, respiratory therapists, all of these health professions are facing shortages in one way or the other. And so to your question, yes, It's across Michigan, it's across southeastern Michigan, and all those organizations that signed the letter. Anything that we can do ever when we have a solution to a problem is so important to do it, because then that burden is avoided, it's eliminated. So thank you for that question.
Thank you. Sorry, I was struggling with my technology there. I am going to go ahead and wrap things up and see if I can win some brownie points with Dr. Adnan's, Dr. Munkarah's admin, so that I can get him out of here on time. Folks, I do want to leave you with any closing remarks from Dr. Munkarah or Barbara. So Adnan, if you have anything to add, please go right ahead.
The only thing I want to add is listen to the plea that my colleague Barbara Rossmann and our other chief medical officers and chief nursing officers have sent in the letter in the past 24 hours. This is really a plea to everyone that we need to be part of the solution. We need to protect our community. We need to protect our families. Our vaccination is our way out of this tragedy that we have lived for the past year and a half. And let's work together to get us to the other side.
Thank you very much.
And from my perspective, I would echo what Dr. Munkarah has shared. We are all in this together, and we have the opportunity together to end this pandemic. So let's do it. Thank you.
Thank you so much. And I'm actually going to leave with another, Dr. Munkarah, please feel free to go if you need to get to the next meeting. And Barbara, you too. I kind of ruined my transition. Barbara said, let's do it. I can't quite remember the slogan for McDonald's right now, but I do want to let our friends in the media know that HAP and Henry Ford are offering drive-through COVID vaccines at a McDonald's in Detroit tomorrow. So if you know anybody who needs a vaccine and a cheeseburger, please send them to 21640 Grand River in Detroit tomorrow from 10 to 4 p.m. And I will leave you all with that. Thank you so much for your patience today and for tuning in. Thank you, Dr. Munkarah, and thank you, Barbara.
Thank you all. Bye.
Bye.